Can Xanax cause dementia? No, Xanax, generic name, alprazolam, does not cause dementia. Xanax is a benzodiazepine medication primarily prescribed for the treatment of anxiety and panic disorders. It works by enhancing the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain, which helps to reduce excessive activity and promote relaxation. Dementia, on the other hand, is a syndrome characterized by a decline in cognitive abilities severe enough to interfere with daily functioning. It is commonly caused by conditions such as Alzheimer's disease, vascular dementia, or Lewy body dementia. While Xanax can have side effects, such as drowsiness, confusion, and memory impairment, these effects are generally temporary and reversible. They are more likely to occur at higher doses or with prolonged use. However, they do not lead to the development of dementia. It is important to note that the use of Xanax should be done under the guidance and prescription of a healthcare professional. They can evaluate the potential risks and benefits and monitor any side effects that may arise. To further illustrate, let's consider an example. Sarah, a 45-year-old woman, has been experiencing severe anxiety attacks for several months. Her doctor prescribed Xanax to help manage her symptoms. Sarah was initially concerned about the potential for Xanax to cause dementia, as she had heard rumors about such a link. However, her doctor reassured her that Xanax does not cause dementia. He explained that while Xanax can have cognitive side effects, they are generally mild and reversible. Sarah decided to trust her doctor's expertise and began taking Xanax as prescribed. Over time, she experienced a reduction in anxiety symptoms without developing any signs of dementia.